What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, September 14th, 2023. We do have several news stories to share with you today, which it's kind of set us up in the beginning as a grim picture, but when we get to the data portions of things, you're actually going to see some encouraging signs, or at least what I think looks a little bit encouraging. So let's get through the news, then we'll get through what some encouraging data. It's mixed. There's also some data that's not so encouraging either. Starting off today, this is from the New York Post. We don't usually show New York Post stories. They sometimes lean further to the right or whatever the case may be. But in this case, we have to show a New York Post story because it has to do with a luxury cruise ship charging $33,000 per person stranded in freezing Arctic. Now, what does that have to do with the pandemic update? Let's read down below and I shall explain. A luxury cruise ship that charged passengers $33,000 has run aground in remote area of Greenland and will be stranded for days in the freezing Arctic, waiting for help to arrive, according to reports. And let's skip over to the next one and come down here. But I should add, there's 206 passengers on board. That's something important to take note of. To make matters worse, several cases of COVID have been reported on board among the mostly elderly passengers, most of whom are Australian, according to the Sydney Morning Herald. And then we have this. We do have a couple of cases of COVID, but there's a doctor on board, Stephen Fraser, told the outlet, adding he contracted the virus aboard the ship. So there's COVID on board. There's a few cases right now, but we do know the total number of passengers is 206. So keep that in mind in case we ever revisit this story, in case maybe the outbreak gets bigger. I mean, hopefully they're able to contain it. We shall see. Remember, this ship is, this luxury boat is not going anywhere right now, and there's COVID on board. That's not good. At least there is a doctor on board. That is one good thing. All right, COVID-19 outbreak closes medicine unit at Stratford General Hospital. This is up in Canada. Again, that's the Stratford General Hospital. And you're going to see some other stuff here about Canada. Absence rates due to illness double in first week and a half at Calgary Public Schools, also in Canada. Then we come over to this, a 1980s alternative rock group. Dinosaur Jr. postpones shows at Stone Pony in Asbury Park hours before show due to COVID, and it doesn't stop there. The band has also postponed upcoming shows in Providence, Rhode Island, Burlington, Vermont, and Portland, Maine. So they are dealing with COVID. And apparently this is not their first time having COVID, because it says, unfortunately, COVID strikes again and we have no choice but to postpone the next 4 shows, said the band in its social media Wednesday afternoon. That tonight's show, meaning yesterday, at Asbury Park will now take place on Wednesday, January 24th of 2024. So that's pretty, they're really postponing it pretty far. So yes, they are dealing with the COVID outbreak. And let's read a little bit further because we actually learned something in here. And it says, there have been 2,335 confirmed cases in New Jersey. This is COVID cases in the last week, according to the New Jersey Department of Health. So that's not good either. Then we come over to this. Japan's Prince Hisahito, hope I'm saying that correctly, good chance I'm not, has tested positive for COVID, which is not good. It's just another case, and doesn't stop there. We do have another positive to show you in just a minute. New COVID-19 outbreak at Canterbury Gardens in Peterborough. I believe this is up in Ontario. It is in Canada. Yep, Ontario, Canada. I'm seeing that in their website here. So yet another COVID outbreak. Now we come over to yet another COVID positive. This time it's the Boston Red Sox. And this is not the first case they've had recently. I believe back in late August, they also had a case of COVID as well. So this go around, Kenley Jansen has tested positive for COVID and is now on the injury list. And believe it or not, this happened while he was playing. He was apparently not feeling well while on the field. He was getting fatigued and tired, and I guess they took him out. I didn't actually watch the game, but I guess the way the story goes is they took him out, COVID test later on, and they found out, hey, he's positive. So the fact they were playing another team at the time, if you know what team that was, let me know down below. I could Google search it, I guess. But the point I'm trying to make is the fact he had COVID while he was playing, we could see more cases come out of this, whether it be from the Red Sox or other teams that they have played. Who knows how many days he's been sick with COVID. It's just ridiculous. And speaking of ridiculous, this is really ridiculous. As Mississippi's COVID-19 hospitalization spike 145%, Governor Reeves rejects mitigation efforts. I mean, 145% increase in hospitalizations in your state. I think it's time to step in and say, whoa, we need to look at what's going on here and maybe do a little bit of action and try and get these numbers down. Totally ridiculous. I mean, we know eventually it's going to come down on its own before another surge comes, which you'll see in a few minutes. There are some states that are, believe it or not, starting to come down. We'll see. All right, taking a look at air quality for today. And actually, you're going to see some good things on this map. A cold front came through the northeast, which it did bring a tremendous amount of rain to some places. But it also swept out the humidity. And look at the air quality in the northeast. The best we have seen in a very long time. What we're typical for seeing in fall. The south, still some yellows on here, but not terribly concerning. The Great Lakes, not terribly concerning. The West Coast, not terribly concerning, except for portions of California, Oregon, and Washington. Again, you can see here some yellows, but you also see some purples, reds, maroons. Yeah, that's not good. And unfortunately, as long as the wildfires keep going out there, that's going to continue. I do have another channel. It'll be listed down below where I do climate updates. I'm going to be doing one a little bit later on this evening. Moving on now to, let's talk about heat-related illnesses. Yes, it's still high in the east, but that is going to start to drop now. We expected it to rise this week because last week was really hot, humidity was up. Next week, I suspect this map will be much improved. Maybe the west will still have a little bit of issues. Maybe the deep south will still have some issues. And let's come over here to Walgreens. The positivity at Walgreens this week was 40.6%. The prior week was 40.2%. That's a difference of up 0.4%, but I suspect this may slowly start to drop soon, but we'll have to watch. It may not, because testing is starting to drop now. Last week had 6,732 tests. This week, only 4,733 tests. So testing's starting to drop, and we'll have to see here. In some places, cases may be starting to come near the peak for this wave, but the question is, are they actually going to go sharply down, a little down, or just level off and not drop at all? So who knows what's going to happen with this positivity. I mean, given that testing is down, maybe it does rise again, but you can see here, it was starting to go down. I thought that maybe that would continue. Hard to say. So I probably really should not give a prediction about that, but what I can tell you is BioBot has updated. Now they did not do a correction this week, but they did do the Thursday update, and look at this. The South, yeah, it's starting to drop in the South, but full disclaimer, I don't think that should probably, Florida, I don't think you're dropping yet, because Florida hospitalizations are still on the rise. We'll get a weekly update out of Florida tomorrow. The Northeast, look at that, little sign of the Northeast dropping, and you know what? It could be dropping in the Northeast. We'll take a look at New York State in about 3 minutes. Taking a look here to Midwest, it's leveled off. The West Coast, yes, the West Coast is still rising. We'll have to see how much longer that goes, but you're not rapidly rising. It's just a slow, steady rise, which is not terrible. And when we compare this to other waves, I mean, we've had bigger waves than this, but the key takeaway here is, remember last year, where it would start to drop and then rise again, and that's probably what's going to happen here. once we get into some point in October, the next wave's already going to set in because this HV.1, some are saying that could be our next wave. Speaking of variants, let's take a look at a couple of variants, shall we? Now, we'll get an update out of the variants tomorrow. EG.5, as of today, is 21.5% on the data. FL 1.51 is 14.5%, and that HV.1, which I just mentioned, is at 5.1%. All right, let's take a look at a few of those wastewater sites that don't only show COVID, but they also show other things as well. And you might notice on this map, slowly but surely here and there are a few more sites popping up. And I say today, we haven't done this in a while, let's go to Kansas City, shall we? Kansas City, Kansas. And we can see here, 90,000 population. COVID at this time is dropping. Going to move myself to the left so you can see this better. Influenza and RSV, not detected yet. HMPV, not an issue yet. Mpox, not an issue. And norovirus, it did drop, but now it's flat to almost rising a little bit again. So that's not something we'd like to see. We would like to see that continue to drop. And I don't know, let's go down to North Carolina, shall we? Let's go west of Greensboro to Winston-Salem, where COVID at this time is still rising. Influenza, there was a little bit to end August, but it has since dropped. RSV has dropped. There was, again, they had that at the end of August, as did with HMPV, but that's not an issue anymore. Mpox, look at this. None. That's good. And wow, so norovirus, end of August, went shut up, and then it went straight back down. And the overall trajectory, going back to early summer, is down with norovirus, despite the fact that they did have that big rise there in August. But now it's back to going downward again, so that's a good thing. And let's be fair, we did the central region, we did the east. Let's do one site on the west coast as well. Let's just go to Gilroy, California. I can't say we have ever done this one before. And interesting trend here. So the overall trend for COVID was up, but now it is dropping. So that's good. The summer surge might be ending there, but influenza, it's starting to go up. And now it did drop on the most recent update. These are not really high levels yet, but hey, a rise is a rise. So flu is starting to rise. There RSV, yes, it has been up and down. So there's been a little RSV hiccup. That could develop into something bigger as we get deeper into the fall. HMPV, not an issue, but look at this. Back in, when is this? July 28th, they did have a detection of Mpox, and it was a high detection. So someone, or maybe a couple people, in this wastewater area did have a case of Mpox. But now that is since cleared. There is no Mpox at this time, norovirus at this time. The overall trend is dropping, but you can see here, there was a increase at the end of August, early September, and now it's back to dropping again. So that's good, and quite frankly, it's dropped pretty low, just to 1,400. So already we did a few of those wastewater sites. We did the variants. We'll get a full variant update tomorrow. We do have to refresh this. This map may look a little different. And wow, look at the south. This is emergency department visits, and you can see here, it's dropping in the south. Still rising in a few places in the Great Lakes and Northeast. Kansas is still rising, South Dakota, North Dakota, Idaho, Utah. All these yellows, they've gone stable. So this map is looking a lot better than what it did just in the last few weeks. And what's happening in the south, I think that's going to eventually spread to the north. Because there is signs in New York State, and I promise, we're getting to New York State. We're getting close. Got to do Chicago and New Jersey and Philly. Then comes New York. Hospitalizations in Chicago, they've dropped ever so slightly. Let's move myself back to the right. Beds in use, looks like that may be, it's up a little bit. Overall beds in use. Emergency department visits, looks like that's up a little bit. Confirmed cases, though, they're down. 155. Prior week was 161. That's a drop. Deaths, looks like they're flat. And taking a look at vaccines administered, ooh, that's down. We hope to see that go up because the booster, it's available now. New Jersey, not much I can say about New Jersey because New Jersey, only 19 hospitals out of 70 reported. Is it worth me running through these numbers? I mean, that still totals 191 hospitalizations. So if the other 51 hospitals decide to report all at once, which I don't know if they will. We got a Jewish holiday coming up. It could be a concerning number. All right, let's move over to Pennsylvania, specifically Philadelphia. 797 EMS incidents yesterday. Day before was not much higher. So, I mean, it's right around that 800 level. So, I mean, it's still concerning, but I think we're slowly, finally starting to come down in Philly. At least I hope. And let's do a live look in at the suburbs. Montgomery County, we could see a lot of calls tonight. It's football night here. It's Eagles football night. I mean, a lot of people probably off tomorrow. There's going to be a lot of alcohol involved, so that doesn't really concern us when it comes to the pandemic. But the fact you do have a pandemic at the same time, that could stretch EMS. That could make for some busy periods in EMS. A lot of people say, oh, well, they don't just go to parties and test positive right away. No. The incidents that happen at those parties are happening at the same time we are in a COVID wave. So, I mean, they could be out on COVID calls plus the added calls from an event. Get what I'm saying? Some people criticize me when I say, oh, they don't test positive right away. That's not the point I'm trying to make. The point I'm trying to make is that, emergency services such as ambulances are already potentially busy on other calls that, wouldn't exist if there was no pandemic. Alrighty, taking a look here at LA. We can see here, I don't think this updates till tomorrow, but we'll show it anyhow. LA is dropping a little bit for testing, unfortunately, and hospitalizations, they have leveled off. Alright, drum roll please, New York State. Now, they did have 3,500 new cases today, but that does include reinfections. Here comes the good news. Look at hospital admissions. They may be starting to drop now. Yes, that's good, right? We like to see hospital admissions showing signs of dropping. And let's go to the actual hospitalizations. Now, let's zoom this in. It's going to be a little hard to see, but actual hospitalizations, yeah, they've had a big decrease. So on the first update of the week, on the 11th, was 1,493 hospitalizations. Yesterday was 1,478. Today's report, 1,392. That's a good thing, right? Now, ICUs, they're up by one from yesterday. But again, hospitalizations in New York State are starting to drop at this time. And let's take a look at New York City. Could the same be happening there? Yes, we're seeing small drops in New York City as well. So I'm encouraged. We'll have to see. It could just bounce around now where it doesn't drop, or it could drop a little bit. But as we know, HV.1 is waiting in the wings, and in October, things will start to, unfortunately, go back up again. Texas did update this week, and here's more good news for you. Texas, current week's cases, 24,495. The previous week was 31,175. That's a decrease. Now, there is some bad news with this, and I'm going to go right to the bad news. Hospitalizations did rise again, but keep in mind, folks, that's a lagging indicator. So if the cases are dropping now, we would suspect hospitalizations start to drop next week. But could it be that cases are down because of a testing decrease? That's also possible. So we'll just have to see what happens next week. There is one bit of good news here, and the number of fatalities is less this week. 35 versus 42, down by 7. But it's still sad to see 35 deaths. Now we come over to Ohio. Once again, everything's mixed data today, and Ohio certainly is just that. We just showed you some good news. Now we're going to show you some bad data. Ohio, cases went higher again this week. 9,690 cases reported in the last week. That's not good. Hospitalizations are up as well. There's a account on Twitter. I can't think of his name, but he constantly posts updates on the ER situation at his hospital in Northeast Ohio. And he's saying the ER has been slammed, and he's saying there have been COVID positives. So, I mean, look at this. 259 more people in the hospital for COVID in Ohio. But again, remember this. They show a total count for the entire pandemic. I would like to know what the actual current number of people in the hospital is in Ohio right now. I honestly don't know what that is. Maybe there's some way someone can get it. I don't know, but we're not seeing it right now. And there are people in the ICU as well. That's not good. And they also added 19 more deaths, which that's sad as well. Shall we briefly do an international? Yeah, let's briefly do some international numbers here. Taking a look internationally, Russia cases are up 25%, deaths are down 38%. Romania cases are up 50%, deaths are up 17%. And then we come down here to Poland, where cases are still up 73%. 2 deaths versus 2 deaths, so that number stayed the same. Mako, cases are up 3%, no deaths reported. Hong Kong, cases still up 10%. Then we come down here to Bulgaria, where cases are up 64%, 3 deaths reported. Denmark, cases are up 81%, and they do have 14 deaths reported. Chile, 123% increase in cases and no deaths reported. Alrighty, folks, that does it for today's pandemic update. You may have noticed yesterday we did not do a pandemic update. There's going to be days from time to time where we do not get an update in. It's just because of my schedule and how things work out. Sometimes it's a rat race to try and get an update out. So there's going to be days going forward from time to time where we don't do an update. That's okay. We make up for it. We make sure, the goal is I'm going to make sure I do at least 4 updates a week. It's very important that we continue to do these updates, and some weeks we'll have more than that. If you like this content, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see content like this, by all means, share this with them. I will see you all again next time. But until I see you again next time, stay safe, everyone, and have a great evening.